Then we come to another, that there is one more tissue which loves to have microvascular disease, that is your neurons. We call it diabetic neuropathy. Diabetic neuropathy. What is it? Diabetic neuropathy. So we have talked about diabetic retinopathy, diabetic nephropathy. We are going to talk about diabetic neuropathy, and all of them may involve what? Pathology in small vessel, microvascular diabetic disease, or we call it microangiopathy. Is that right? Now, let's talk about neuropathy. This neuropathy, it occurs in different forms in patients. One of the common manifestation is peripheral neuropathy, peripheral polyneuropathy, most commonly in lower limbs. Right? In the lower limbs, the neurons, especially sensory neurons, they may undergo dysfunction. Right? But not only sensory, motor neurons can also suffer. Now, if sensory neurons initially involve the lower limbs or feet, usually they develop symmetrical disease. Whatever is on the right side, same is on the left side. Sensory problem, paresthesias, hyposensation or hypersensations, right? Paresthesias, tingling, pins and needle, and later on they may involve the hands. That is why diabetic neuropathy is one of the example of polyneuropathies, peripheral symmetrical polyneuropathy, also called gloves and stocking disease, because gloves area and stocking areas, this is not stocking a girl, this is that stocks, right? So what I'm talking about, that these diabetic neuropathies, first of all I talk about what kind of neuropathy? Polyneuropathy. What kind of polyneuropathy? Symmetrical. Symmetrical means whatever is happening to the right side of the body, similar neurological damage is occurring to the left side of the body. And classical example of this is, yes, gloves and stocking. And this also contribute to the diabetic foot disease. This also contribute to diabetic foot disease, because as I told you previously, macroangiopathy in the lower limb produces ischemia to the foot. They contribute to the ischemic damage to the diabetic foot. But if sensory nerves are damaged, then patient might get little bit injury and ignore it, and that area may become later on infectious, and infection may spread, and this little problem, yes, this little problem might end up eventually into amputation of the some part of the lower limb. Is that right? Diabetes is one of the commonest causes of amputation of adult lower limbs, non-traumatic, right? Of course, you can get amputation if you really want. There are so many ways. One of them is accidents, trauma. But non-traumatic amputations of the lower limb most commonly occur in the patient, are done most commonly in the patient which are diabetic. Why? Because diabetes monster attacks the foot in many different ways. I don't know, this is very bad. It loves to damage our heart, loves to damage our brain, loves to damage peripheral vessels, and then it attacks the small vessels and loves to damage the retina, loves to damage the kidneys, and now it is attacking the neurons. So in lower limb, if sensory neurons are dysfunctional, that will lead to less awareness of trauma to the lower limb. And if motor neurons are damaged in the lower limb, then person will develop abnormal mechanics of joints and muscles. Abnormal mechanics of joints and muscles that may produce inappropriate pressure points in the lower limb, especially on the sole, and that might produce, yes, already blood flow is less. At the top, neuronal sensitivity is less, and then there are abnormal pressure in some areas of the sole that will produce damage and ulcers there. And here I must mention that when we talk about the neuropathy, about the foot, and we talk about the vasculopathy is macrovascular and neuropathy is microvascular, right? And later on I will tell you, in diabetic foot there is also tendency of increased infections, right? Later on, much later on, we'll have a full lecture, 1 hour lecture on diabetic foot. But let's come back. So we were talking about neuropathy, polyneuropathy, symmetrical polyneuropathy. If it is in lower limb and upper limb both, then it is gloves and stocking distribution. But some diabetic patients develop mononeuropathy also. Some diabetic patients develop mononeuropathy also. And mononeuropathy, it means that there is isolated nerve damage that might not be symmetrical. For example, if I develop my oculomotor nerve damage, or I develop damage to the abducent nerve, right? Now, if isolated abducent nerve damage is there due to diabetes, right? Abducent nerve is 6th cranial nerve which supplies the lateral rectus, right? Now, that is also neuropathy, but because one nerve is affected and other nerve is not affected, right? Or on one side median nerve is affected and other side median nerve is not affected, then we cannot say that this is symmetrical disease. This asymmetrical nerve damage, if it is one single nerve, we say it is mononeuritis. This mononeuritis can occur in the sensory nerves and also can occur in motor nerve. Then we come to another condition, that let's suppose you come across unusual patient who has abducent nerve damage on right eye and oculomotor nerve damage on the left side. Very unfortunate patient, develop median nerve damage to right side and radial nerve damage to the left arm. What do you think? It is polyneuropathy?
No.
It is not symmetrical polyneuropathy. It is still mononeuropathy at multiple places. It is mononeuropathy at multiple places, because when we are saying polyneuropathy, then there should be symmetrical involvement. But if one side is abducent nerve damage, other side is, yes, oculomotor damage, one side is median nerve damage, maybe other side is radial nerve damage, one side is sural nerve damage in the leg, other is peroneal nerve damage. So these are not polyneuropathies. These are mononeuropathies, but at multiple places. This condition is also called mononeuritis multiplex. Multiplex, you know, like cinemas, multiple screens. So multiple nerves are involved. We call it mononeuropathy multiplex. Then we come to another condition, that unfortunately this not diabetes, microangiopathy, not only damages the sensory and motor neurons, it can attack the autonomic nervous system also. It can attack the autonomic nervous system also. And if it damages the autonomic nervous system, right, there will be other problems. For example, if autonomic supply to the heart is damaged, right, then variation of heart rate will be reduced or increased?
Increased.
Variation will be reduced. Variation of heartbeat, beat to beat variation will be reduced, because if you have healthy autonomic nervous system controlling your heart, then of course adrenergic supply or noradrenergic supply, that increases the heart rate, and cholinergic supply decreases the heart rate. But if both of them are dysfunctional, increase and decrease in heart rate will not be showing variability, right? So heart rate variability will be reduced. Then in such patients who have autonomic neuropathy, they may develop orthostatic hypotension. What is orthostatic hypotension or postural hypotension? That from lying down position, for example, here you are, I hope you are not red-headed, but anyway, here you are lying down or sitting, and if first normal, you are normal person lying down, and due to some reason you suddenly stand up. What should happen? That blood should fall to the lower part of the body due to gravitational effect. But lower limb vessels immediately contract. When from lying down position, a healthy person suddenly stand up or sit up, we expect that blood, due to gravitation effect, blood should pool in lower part of the body, and there will be more venous pooling in lower part of the body. And if there is more venous pooling in lower part of the body, less blood is returning to the heart, and cardiac output become less, and that may lead to blackouts, and your blood pressure may fall down significantly. But in normal healthy person it does not happen. Why? Because whenever you change your position from lying down to standing up, there is a burst of sympathetic activity to the vessels in the lower part of the body, and lower part of the body vessels constrict and squeeze the blood so that it does not pool into lower part of the body, and there is appropriate return to the heart, and cardiac output is reasonably maintained so that you don't develop vertigo or you don't develop blackouts or complications like this. You are understanding? But if there is a patient with diabetic neuropathy and diabetic autonomic neuropathy, and that autonomic neuropathy is damaging the neurons, sympathetic neurons to the blood vessels, patient may suffer from orthostatic hypotension or postural hypotension, because from lying down position, when he will stand up, sympathetic nervous system is not working and vessels will not squeeze, right, and blood will not be returned properly to the heart. It will pool into lower part of the body, and venous return will be less cardiac output, and when there is less cardiac output, patient may develop vertigo, even blackouts, right? Then this autoneuropathy may involve the autonomic nervous system to your gastrointestinal system, right? If your gastrointestinal system is affected, right, GIT motility will become abnormal. You know, vagus nerve, which is the classical example of parasympathetic nervous system. Vagus nerve is motor to GIT. If this vagus nerve develops, it has lot of what type of fibers? Autonomic fibers, right? Vagus nerve. If vagus nerve develop diabetic, macrovascular or microvascular? Yes, microvascular, very good. Microvascular disease, vagus nerve develop, the motor nerve to the gastrointestinal system fails, and might be it will have multiple complications. One of the complications may be that this failure of autovagal supply to the stomach may contribute to a condition called gastroparesis. What is that? Gastroparesis. That stomach as movement is weak and feeble, right? We call it gastroparesis. Then there are some very unfortunate, I think, situation in some diabetic patient, that autonomic nervous system going to the urogenital, system is damaged. That may lead to urinary retention because autonomic nervous system plays a major role in urination. Is that right? Actually, cholinergic system help the vasculature of what is this urinary bladder to contract. So if it does not contract well, that may lead to urinary retention. And another very unfortunate situation might be, yes, impotence, right? That autonomic nervous system is disturbed to the male organ, and that may damage so much that blood flow to the male organ is altered so much that erection cannot be maintained for appropriate penetration, right? I don't know much about inappropriate penetration, but anyway. So what I say that it can produce impotence also. This is one complication in the diabetic patient which as a doctor you should ask, but please ask only men, right? Because usually they are shy to talk about. You know, there's something very strange. Women find it easy to talk to their doctor about their urogenital problems. Men feel more difficulty to talk about it. You know why? Because due to periods and their irregularities and pregnancies and due to other gynecological reasons, women are more used to talk to the healthcare provider about their problem. Because men are not so regularly going through such processes, so once they develop impotence or anything like that or some problem, they find it very difficult to talk to the doctor, right? So this, as a doctor or as a nurse, you should inquire male patients who are diabetic if they have problem related with urogenital system or not. So what I wanted to say that it can produce macrovascular complications. It can produce microvascular complication. We are still passing through an introduction to diabetes mellitus, because in coming lectures I will go in detail of, there will be lecture only on diabetic neuropathy, its management, its clinical features. There will be lecture only on what? Diabetic nephropathy, its clinical features and its management. There will be hopefully lecture, complete lecture on diabetic retinopathy, its progression, its stages, its causes and its management. Right now I am just trying to tell you how bad is diabetes. Diabetes is everything sweet is not sweet. Diabetes mellitus. Diabetes means lot of urine is coming and mellitus means sweet. But every sweet thing is not necessarily too good. Diabetes mellitus is one condition that we can say this is sweet diabetes. Unfortunately, it's a monster. With death string, what was that? Hyperglycemia. Two ends of the death string. Type 1 diabetes where less insulin is produced or no insulin is produced, or type 2 where at least initially insulin is there but there is more resistance to flow. And then there are many other death gems inside like type 1, then there is type 2, then there are LADA, latent autoimmune diabetes of adult, or there is MODY, that is maturity onset diabetes of young, right? Then there is in between secondary diabetes. There are so many causes, we will talk later. I will of course discuss, there will be a full lecture on pathogenesis of type 1 diabetes, and there will be another full lecture on the pathogenesis of type 2 diabetes, and then there will be another lecture for the pathogenesis of rest of the types of diabetes, right? But what I was saying that in between type 1, type 2, then there is, yes, LADA and MODY, and then there is secondary, and there are gestational diabetes and many other which are less common, we will discuss later, right? We have a lot of time. Then I told you that I didn't tell you the general clinical features of diabetes, but I wanted to tell at least complications which I mentioned, that this disease is so dangerous that number one, I feel personally it is more dangerous than corona. Corona either kills you or leaves you. But this disease, if comes once, it keep on staying with you, sometimes lifetime. And it has so many different ways to kill you, and it kills inch by inch. Today you are going for the foot complication, maybe after 2 days you are going for renal complication, maybe after 5 days you are going to ophthalmologist for retinal complications. It's a very sad story. And unfortunately, this disease is so rapidly spreading that some authorities believe that 10% of the adult population in the world is suffering with this disease. Every 10th person. And in some countries, in the adults, every 5th person is having diabetes mellitus. But why this diabetes mellitus is getting so common that in some regions of the world it is spreading in people as if it is an epidemic. Thanks God it is yet not pandemic, but it has already achieved a status of epidemic. Why? Few reasons which are mentioned are lifestyle changes, right? For example, now our nutrition is not as healthy as it used to be in the 100 or 200 or 500 years back, right? Processed food, more sugars. Then not only nutrition is not healthy, then our physical activity is reduced. If you are very rich, even you don't want to open the door of your car, I think you love to have diabetes, right? For everything we want remote control. We don't want to do exercise more than the thumb muscles. So this is very sad. So overeating of calories and taking the processed food at the top, reduced physical activity, and then aging population. We refuse to die because there is so much medical care available that we keep on lingering with the life, right? So aging population, right? So aging population, nutritional abnormalities, reduced physical activity, and what else can be there? Maybe the stresses of modern life, right? Some people say that why modern life has more stress. I say it's very natural. If you are living in a village and all your life you spend in a village 500 years back, you know about 100 or 200 people, right? But when you are living this in global village where so much technology, someone dies 20,000 kilometers away, it might have stress on you. And in the morning in a big city, if you move, commute to your job, maybe you see on the way 5,000 faces, human faces, and we learn to ignore them, and that adds to the stress. So there are so many modern stressors also which are added to our life, right? So all these things together have disturbed our metabolism because we are not designed to sit and read the medical books. We are not designed to sit and pass the medical exams. We are designed to live in a jungle. Either we are running after smaller animals or bigger animals are running after us, right? Yeah. That is more natural life for which our metabolism and our whole system is developed, right? I was telling few days back that physical activity is very important, right? It is so important that now doctors have discovered and researchers have discovered even your walking can produce neuron growth factors. Neuron growth factors, because all sensation and proprioception going to the central nervous system is telling you might be you are walking in the jungle. You know, our body is not evolving so fast as fast the technology is evolving, right? And your central nervous system should be more alert. And what happens? Not only it produces endorphins, it produces growth factors in the central nervous system, right? So what we were talking about, now we come to some miscellaneous complications. right, which I mentioned, there was gastropathy, and in gastropathy, what is contributory factor? There are multiple reasons for gastropathy, which we will discuss later, but one of the, yes, you have a question.
Sir, neuropathy is the problem with neurons. So neurons are neurons, these are not blood vessels. Why we are saying that this is a problem with microvascular?
Okay, he has come with the question that neurons are neurons and neurons are not blood vessels. So why we are saying that neurons are having microangiopathy? You must know that neurons also have microvessels, not neuron. Actually, nerves have small vessels. There are vasa vasorum going into nerves, and vasa vasorum divide into millions of capillaries, and those capillaries which give nutrition to the neurons. Neurons use a lot of nutrition, right? And those capillaries develop advanced glycation products, and that can lead to the trouble, right? So let's come forward, and we were talking about, yes, other complication. Gastropathy we have already discussed. Then there can be cataract. Cataract. Please don't tell anyone that cataract which develop in diabetic patient, right, that is due to microangiopathy. That was retinopathy. Cataract develop due to basically patient with the diabetes, especially with the uncontrolled diabetes, having very high repeated spikes of hyperglycemia. Why do they develop cataract? One reason is that when hyperglycemia occur, lot of glucose enter into lens, and there this glucose is converted into sorbitol. This glucose is converted into sorbitol, and this sorbitol which accumulate in the lens, when later on our, listen now carefully, later on when hyperglycemia go to normoglycemia, sorbitol is trapped in the lens and it cannot come out, and it produces osmotic effect. And when sorbitol is there, and again hyperglycemia, lot of glucose enter into lens and convert into sorbitol. When euglycemia occur or normoglycemia occur, sorbitol cannot leave the lens, and this accumulated sorbitol within the lens pulls the water, and this sorbitol and water plus glycations, all of them disturb the, damage the lens normal collagen and normal proteins, and which become opaque because they disrupt the special arrangement of collagen in the lens and special arrangement of proteins in the lens which keep the lens transparent. So lens become parts of the lens become opaque. So we say cataracts develop, and these are also diabetic cataracts. Are, if you develop diabetes at early age, then this will be presenile cataract, right? Then it can produce not only cataract, this can produce glaucoma. Yes. What is glaucoma? Glaucoma is pathological increase in intraocular pressure. You know, okay, let me draw a eye here. Yes. This is your cornea, iris. What is this? Ciliary body. And what is this? Choroid. Again, what is this? Ciliary body, and there is iris, and in between here is pupil. As you know, this is cornea, right? That at this angle in the trabeculi, this is a system to drain the aqueous humor, right? At this angle in trabeculi, two types of problem can occur. Number one, advanced glycation, glycated products, and trabeculi, yes, trabeculi become thick and drainage slits become narrow, and you develop glaucoma. Drainage system is blocked. Why? because there is abnormal glycation. Number 2, there can be neovascularization here. Pathological new vessels develop here, right, at the drainage angle, and aqueous humor cannot drain, and that leads to what? Raised intraocular pressure. So, if someone asks you what are the ocular complications of diabetes mellitus, yes, a good doctor will say diabetic retinopathy, then some better than good doctors say cataract also, then super good doctor will say glaucoma can occur. Then there is excellent doctor who will say even damage to the muscles which are controlling the movement of the eye, damage to the abducent nerve, damage to the oculomotor nerve. So there are so many complications of diabetes related with the eyes, right? After this, glaucoma, we can come to your favorite thing, why infections are more common in patients with diabetes. Okay, this is very important question. We will have a full lecture on it, but right now a little introduction. Why infections are more common in patients with diabetes. I would love to explain this in reference to diabetic foot. Even though these patients develop infections in many areas in the body more frequently as compared to the normal population. But right now, I will specially mention the infections in the foot. Now, in diabetic foot, why infections are common? Some reasons are very clear. There is neuropathy. If there is sensory neuropathy, of course, they will hurt or damage their foot, and they will not knowing it. And through that injury point, infection can enter. Number 2 reason can be that motor nerves to the foot and muscles are damaged, and due to that reason, abnormal mechanics of muscles and joints and the bones interaction produces abnormal pressure point, and that may produce ulcers, and those ulcers expose foot to the infection, right? So neuropathy is there. Then more infection in the foot. One more reason is vasculopathy, that there is reduced blood flow. If there is reduced blood flow, it means less nutrients are coming for the repair, and less immune components are coming, less antibodies, less neutrophils, less monocyte or T cells or other defense mechanisms or complement factors. So, due to vasculopathy, what is happening? Number 1, again, it's worth concentrating, because many people very unfortunately undergo what is this? Amputation, non-traumatic lower limb amputations, right? There can be sensory component which is disturbed, so they get more injuries. There might be motor system disturbed, abnormal pressure points may lead to ulcerations and more infection chance. Then there is vasculopathy, reduced blood flow, foot becomes ischemic, and that lead to reduced nutritional supply for the healing and reduced immune components to fight with the infection. This is generally, but let me tell you more specific reasons that even a person develop otitis externa, or he develop boil here and it is not healing, rather infection is spreading. Why it is happening? The reason being, there is severe, if diabetes is uncontrolled, there is severe dysfunction in immune system. Look at the red blood cells, not red blood cells, sorry, neutrophils. Neutrophils, if there is too much glucose they take up, they just like become drunken men. You have seen drunken men? They are I think you must have seen it, right? You have been with your friends. They keep, sometimes at midnight, they are moving in the streets and they don't know where to go and what to do. Same thing happened with the neutrophils. They are drunken with the oversupply of glucose, and this oversupply of glucose to the neutrophil produces dysfunction. These drunken neutrophils, they don't stick to the endothelium. They cannot knock at their door. They don't know where is the door, where is the house. So where there is infection, they cannot stick there. Then even if they stick there, they are very poor in chemotaxis, because increased glucose is disturbing all motor proteins which are responsible in the neutrophil for chemotaxis and movement. Look at it, drunken man wandering in the blood vessels. First, he doesn't know where the endothelium he should stick, knock his door, and even if he reaches door, unable to enter and go to the bedroom. Here the bedroom is where the infection is, no chemotaxis. It's so drunken. And it's so drunken, even you put something in the mouth, phagocytosis, they are unable to eat. Whatever you put, they drool out. So these neutrophils are having less stickiness with the endothelium. They have less chemotaxis, directional movement towards the focus of infection. They have less ability for phagocytosis, and even if they phagocytose something, they have less ability to kill that organism, which is microbicidal activity. That is also reduced. So what happens? That if you are a diabetic patient and your blood sugar is unfortunately not properly controlled, and your neutrophils are always drunken and happy with this so much glucose, they are going under multiple malfunctions, failure to stick with the endothelium in the inflamed area, failure to do chemotaxis, failure to do the phagocytosis, and even if do the phagocytosis, failure to what? Failure to kill the organisms. All these things increases our chances to suffer with infection. And then even macrophages also become drunken. I mean monocyte, when monocyte move out of blood vessel into inflamed tissue, we call them macrophages. They become so drunken that one of their important function they don't do. That important function is to produce the cytokines, to call more neutrophils and call the lymphocytes. If I am a monocyte, I should slip out of blood vessel in area of inflammation, and I should go into tissue, and you should change my name to macrophage, and then I should start giving cytokines. Cytokines are just like calls to more neutrophils. It's very interesting. At the site of inflammation, neutrophil produce the product which call macrophages, and macrophages produce the product which call neutrophils. So they are calling more forces, but these macrophages go and sit there, forget how to do phagocytosis, and forget to call more neutrophils, and forget to call more lymphocytes. So lymphocyte dysfunction also develop. All such dysfunctions lead to increased chance of infection. So what I was talking about, that unfortunately in these patients infections are very common. So unfortunately, not only baby, some even microbe also love the candies, sugar loving microbes. And patient with diabetes, these sugar loving microbes, glycophilic microbes, they are in paradise, right? Why they are in paradise? More sugar to enjoy, and all the neutrophils which want to kill them are themselves drunken, and all the macrophages forget to call the forces, and microbes are proliferating, right? So there are so many reasons, unfortunately, in these patients with diabetes to undergo multiple infections, and their infections, they develop infections more easily, their infections spread more, and they heal very poorly, right? And this I will add to the diabetic foot also, that due to neuropathy and due to vasculopathy and due to this failure of immune system or our neutrophil and macrophage system, this all lead to more and more infections in the foot. Diabetic foot will lead to that condition, but we will talk about that later in detail, right? So what we have talked about, diabetic foot, then of course it can even lead to, do you think it's going to excuse you this disease? No. It is not only after your eyes. This disease can be after your ears also. If you ask a good doctor, what are the complications related with the ears of the diabetes, the good doctor will say otitis externa. More good will say more frequency of otitis media also. But there are super good doctor. He will say, of course, otitis externa is more common. Of course, otitis media is more common. But don't forget, 8th cranial nerve, vestibulocochlear system, right? Vasculopathy occur there also. Those nerves also suffer with microangiopathy, and sensory neuronal deafness may occur, right? So what is happening that these patients have macrovascular complications, they have microvascular complications, they have many extra complications like gastroparesis, uropathesis, dermatological complications, of course more infections, and blood vessels in the skin also suffer with angiopathy, right? Then they have more infections, they can have cataract, they can have glaucoma, diabetic foot, and hearing loss. Even periodontal disease is very common in them, because at the junction of, what is this, teeth and gum, in those crevices, many microbes love to proliferate, and our defenses here are very weak, right? So many different types of problems can occur in the patients with diabetes mellitus. And before I conclude this lecture, I will again say there are so many things which are contributing to diabetes in modern era, especially type 2 diabetes is becoming very common. Why? More obesity, less physical activity, more industrialization and automation, right? More aging population, and of course there are more stresses there, right? All these things lead to development of type 2 diabetes more commonly in populations, right? And another thing which I want to tell you, you know what is that? Most of us think that diabetes is a disease of rich countries. Yes, there was a time this disease was the disease of rich country, but now even many countries with you can say mid-range income or low-range income, they are also developing diabetes very rampantly because of changes their habits, right? And I think I should take a break now. This is enough. After the break, we are again going to meet, and it was just an introduction to diabetes. Never forget, if someone say that a person has diabetes, make it sure he has a tendency for chronic hyperglycemia. That is the common thread. Okay? Class dismiss for a while. After some time, we'll again talk. Class dismiss. Thank you, everyone. Thank you.